We certainly spent quite a bit of time talking about mental health reform. I want to talk a little bit about health care in North Carolina and the fact that more than 1 million North Carolinians do not have health insurance. Would you institute, or at least initiate the institution of a community risk pool? If you would, how do you pay for it?
Thank you for the question. I would institute a community risk pool. How you pay for it, if you go to my website, graham2008.com, I've got a lot of new approaches that I want to bring to this issue. It's actually 1.4 million North Carolinians who are uninsured. That is pushing your cost of health care, ladies and gentlemen. That's pushing your cost, because you have fewer payers into the system as the number of uninsured goes up. So what I do is I take the top risk off the top of catastrophic cases. It creates a new dynamic in the risk pool that exists thereafter, and allow you to do things like spread your deductible out over your entire policy year rather than having to pay it all at one time in January, February, or March. And I know what happens. I've talked to a lot of the doctors, and they say the general practitioners, folks stop going to the doctor as often in January, February, March, and so on because of the high deductibles. I let you spread that out over the year. If you want to finance it, you can do that with a bank or credit union or whoever. You can even do it with your doctor and deduct the interest on your taxes. We've got to bring more competition to the system, ladies and gentlemen. And even at the bottom end, with Medicaid and S-CHIP, I allow folks to, employers to contribute to those so that even those folks at the lower end of the economic scale can have more choice. We have got to solve this problem, ladies and gentlemen, because if we don't, business is suffering every year, having to figure out how we're going to carry health insurance from year to year to year. It is strangling our business. If North Carolina can solve this problem, businesses and industry will beat down our door to be here, and I'm going to get that solved for you. Thank you very much.
Thank you. Ma'am, before you care to answer just on insuring or providing health care for uninsured or other health care issues, including maybe rural hospitals which are struggling.
Yes, sir. First of all, I want to compliment Bill. I think he's done some outstanding work in the area of health care and doing his homework, and I compliment him on this area. There are three things I would add to Bill's answer. The first is that we need to incentivize the private sector to give health care to their workers, especially small businesses, to allow them to consolidate their efforts to have lower health care costs. And we need to reenact the tax break immediately for small businesses throughout North Carolina. Our opponents in the Democratic Party are promising free health care to everyone, or at least give the impression that there's going to be free health care for everyone. There is no free health care. Someone has to pay for it, and we all must contribute in that effort. The second thing I would also do is the tort reform, especially for our emergency room doctors in rural areas that are afraid to come in and see patients for the first time because they're afraid of lawsuits. And I hear this from emergency room doctors throughout the state of North Carolina. We need to make sure they're not afraid to do what they think's right as opposed to following some innate procedures. In fact, I've got a nephew who's an emergency room doctor, and he feels like we just have to now follow procedures for fear of a lawsuit, which adds to the cost of health care for everyone else throughout North Carolina. So there's a lot we can do in health care, and we've got to also realize that one of the biggest crises the next governor is going to have to deal with is the health care cost of government employees, because there are so many who retire so early, and no one's talking about who's going to pay for the health care costs for the rest of their life. And that's being swept under the rug, and that burden is going to be on the taxpayers of North Carolina.
Judge Orr, can we fix health care?
Not easily, not quickly, and not cheaply. This is all going to be impacted in many ways by what happens at the federal level. But community risk pools, that sounds great. I'm for it, but I'm not in favor of government mandating that everybody's got to do one thing or the other. I've seen very few programs that government has managed with mandates that has worked successfully. I believe in the free market system, the freedom of individuals to make choices. Do we have to provide, or should we provide health care for our underprivileged and disadvantaged citizens? Absolutely, but we've got to be able to contain cost on that. Since we may not get another question, I do want to make this related point. If we don't have enough doctors, if we don't have enough nurses, if we don't have enough allied health professionals, we'll never have accessible, affordable health care. We've got a growing population in this state. We baby boomers are getting older. We're getting retirees here in the West and on the coast, and we have a shortage of physicians. I'm the only candidate to strongly endorse the expansion of the UNC and East Carolina medical school slots, which includes locations in Asheville and in Charlotte. We've got to have more doctors. We've got to have more nurses. We've got to have more allied health professionals if we're going to adequately address the issue of health care.
Thank you. Senator Smith.
Bob, I endorse that too, but nobody's giving me a piece of paper to sign. So I just want you to know, I'm on board with
That's
it.
what I did.
Let me just say, first off, community risk pools, we've tried that in this state in the recent past. It didn't work because people didn't sign up for it. We've got to talk about health care in a serious and meaningful way. First of all, we cannot talk about the government paying for it. The government cannot pay for the health care burden they now have. So I don't know how they're going to do anything more. Universal health care will not work. If you don't believe that, go ask the folks in Canada. What we've got to do is we've got to have a holistic approach to health care. Health care is not just about doctors. It's not even just about patients. It's about being competitive in the global economy with the burden that we place on businesses. And to do that, we've got to holistically look at it. We've got to do three things. Number one, we've got to have a culture of health. We've got to have people that understand they've got to eat right. They've got to keep their weight right. And we've got to have preventative care. In my company, we pay for a preventative exam for each one of our employees every year. And you know what? Our health care costs went down 15% this year because we do that. Second, we've got to get people to be good consumers of health care by making sure that they have something at risk and to where they don't just go to the emergency room. And the third thing is we've got to use in an effective and efficient manner our health care assets by having medical liability reform, using IT and other things.
Thank you. Thank you very much.